happy segment here is going to talk about infant CPR and first aid. Now, one of the things that is so important is for grandparents like myself and parents and anyone watching this that is around infants, like this little baby right here, awesome, my granddaughter, is to get into a CPR first aid class. Now, there's tons of them out there, whether it's American Heart Association, Red Cross, and any type of exposure to these first aid CPR classes is going to give you that added comfort level that at any time something's happening, whether it's first aid, if they cut their foot, they're bleeding, they happen to fall, or heaven forbid they're choking on something, or if they needed CPR for a little infant, that you've got that time to practice. Now, one of the things that I like to share with parents, get you turned around, is when you hear a baby cry, that in an emergent situation could be one of those most exciting, fun things that's out there. Because guess what? She's breathing really good. Oh, what's wrong? Oh. What? Oh. See, now there's some things that 911 can't help. It would be calling the mother. That sometimes you might need, because she's still breastfeeding. And when she breastfeeds, I can't help at all with that. So, I know, you just didn't want to be laying down, did it? No? So, when we're talking about CPR and first aid classes, they're so much fun because you're around other like-minded parents or grandparents that you're learning the right tools and the right procedures in an emergency situation. Okay? Okay. So you want to try? You want to try some stuff? Oh, I know. Now, one of the first things when you start looking at the ABCs of CPR and breathing is their airway. Little infants like this, they just love to drool, which is an okay thing. But see, she's got a really good airway. And when they take that deep breath, we know that things are really good. Now, anytime a baby, an infant, is choking, you never ever want to stick your finger inside their mouth, because you could see, I know, with as small as their tongue is, as small as her tongue is, and as large as my finger is, by sticking it in their airway, you could actually push whatever is back there further. You don't want that. Now, if you see something in their mouth and see something in their airway, you can definitely reach in and go get it. I know. Okay. Now, this is something that's okay to put in their mouth because it's attached, so it's not. Here, come here. Where are you going? You snort. So cute. Okay, well, in our first video, when Maya here, my granddaughter, started talking so much, above and beyond 911, what's one of the most important things is mom, especially when they're breastfeeding. So we've had a nice feeding. We actually had dinner, so she's doing pretty good, and we're back. So when we were talking about airway, or sort of like when you go through a CPR class, looking at ABC airway, with her airway, as a grandparent, as a mom, as a dad, when you are constantly holding the baby, you can just look and you could tell, because she's moving, her color's good, and there's different places to look to see how well they're breathing. So when we pull her shirt a little bit tight, and even if you just rest your hand on them, predominantly right where their ribs end and their belly begins, you could tell, and I'm feeling that, she is breathing so incredibly good. Plus, of course, she's moving around, and her eyes, she's looking around. But what we're going to do is we're going to see how well she could do when we're on the ground. See how well she's going to like this. Oh, yeah. Now, we know because she's moving around, she's doing really well. But if she was unconscious And you can see here, if you gently feel on the side, and I encourage you as a grandparent, as a parent, when they're sleeping, get so used to handling the baby and just feeling around, because in any emergent situation, you're going to be freaking out, that it's so much better that you practice this when they're happy, they're awake, they've just had dinner, and you're like, oh, okay, I just get used to how my baby feels. So just feeling right here, that's a great place where they get predominantly, you could see and feel their breathing. So her airway, one of the things I wanted to show you is, when we take this out, we'll put it back in real quick. If she was choking, you could tell, one of the rules is you don't stick your finger down a baby's mouth to say, oh my gosh, they're choking. Because predominantly infants this age, she's 9 weeks old, she's not eating hamburgers. She's not eating hot dogs. She's not going to choke on anything that's solid like that. Predominantly, it would be liquid. But when little infants like this, you could see the size of my finger. If I put that down her throat, it could actually cause more harm than good. Several reasons why is because of the nail on here, because parents or grandparents or anyone or the babysitter, they get so scared and freaked out that they go in a little bit too rough. Now, if you did see something, when they're at the age that they're crawling, they like to just stick things in their mouth. That's part of that suckling nature of a baby, that if they get something in their mouth and you see it, absolutely go in there and go get it. Now, with choking rescue, come here. By being able to hold, we'll stand up here. By holding a baby and getting used to how you're holding your child, when they're moving around, they're conscious, they're awake, totally helps. And I found that it helps people, instead of holding a CPR mannequin, now we never ever practice the CPR chest compressions on a baby, okay? But choking rescue, to get used to how you hold a baby and you cradle their face and you could just hold them over, you see right here, you can hit them on their back gently if they happen to be choking. See, but you did really well. As a parent, as a grandparent, to get used to how you handle and move your child around. It's so wonderful to see moms when they're holding their baby, and I've seen it, my daughter, she holds her. She's just like this. She walks around like a little football, going around. The babies love it. She's really used to it. But again, like this, if something was happening, I can use gravity if they were choking. Ooh, but she's doing good. Babies are great. They love to be moved around. So practice different ways of holding a child, because in an emergent situation, it's going to be the best thing for you. Once again, there's all the different kinds of first aid classes, CPR classes, from American Heart Association to Red Cross. Just check your local areas, and most of those classes, when you get into them, they encourage you to bring the baby with you, because then if the instructor's there and you have any particular questions that you want to ask them, it's so awesome that the child's there with you going through the class. So, awesome stuff, and check around for some more information. We'll be back with some more videos too.